long have you been using Isolite?
About 3 years. Actually, when we first started using Isolite, it was about 3 years ago.
And what do you use Isolite for in your practice?
Let me tell you, kids love the Isolite. And I'll tell you why. Because they understand it. It's like a vacuum cleaner. What I tell my kids is, I ask them if their mother has a vacuum cleaner. Most of them say yes. Now the 3-year-olds don't quite get the vacuum cleaner, but they understand it after I explain it. 4 and 5-year-olds perfectly, 6 and 7, they nail it. And I say, it's like when your mother uses a vacuum cleaner to pick up dust. The Isolite is like a vacuum cleaner. What happens is, when you use the Isolite, it picks up the water and the sugar bugs off of your teeth, because I'm going to be cleaning the sugar bugs off of your teeth. I've actually already explained what sugar bugs are to them, so they have a visual of what I'm talking about. And as I go through the process of explaining what the vacuum cleaner is, we also call that piece of equipment, the Isolite, Mr. Thirsty, another good name to use for the kids. I explain to them when I start out, I don't tell them exactly what it is, I just use the verbiage to let them see it. And first I say, can you see this right here? It looks like a princess slipper, unless you're a little boy. And then it looks like Spider-Man's web maker in the palm of their hand. And I take the child's hand, I ask them if they would let me put this in there. And the boys love to put this in there, kind of like Spider-Man's web maker. And at that point I explain to them how soft and natural it feels, and how when it fits between their teeth, that it's going to be like a vacuum cleaner to suck all the water out. I use an analogy and talk a little bit about a soap that I need to put on the tooth to clean it, and I don't want them to swallow the soap. The soap is blue, and so it'll be sucked up right into the water in the vacuum cleaner. That's how I introduced the Isolite. It's an incredible product. Keeps the tongue out of the way. Sometimes I found with the little children, the 3 and the 4-year-old, they might be a little bit uncomfortable with certain parts of it. Pick up a pair of scissors, I snip it off, I can fit it in the mouth. I would say I use it maybe 10 to 12 times a day, and I would say that over the week there may be 2 or 3 children that I have to pull it out and then snip it off, and maybe once or twice a month I'll find a gagger. So if I maybe see 100 children a month that I need to use the Isolite, and it seems to have about a 97 to 98% success rate. So I love the product. I think it's very, very helpful. I think it gives a very good cleaning action of the mouth. It certainly helps when I do things like stainless steel crowns. It's a protector of the airway, and it's certainly an alternative to rubber dam use unless you absolutely have to have everything totally perfectly isolated, which in most cases in pediatrics, except for root canals, we don't need. So the Isolite is for me and my patients. Thank you very much.